Hi, this is Pam Gaither. I am the Executive Director at the Galesburg Area Chamber of Commerce, and we are back again with one of our Facebook Live series that we're rolling out, and we're hoping that this helps with some of the area businesses and even individuals who have questions about things given the situation we're all dealing with. And today I'm really excited to welcome a wonderful community leader in our area, Erin Olson. She's a good friend of mine as well, and most of you know who she is, but she's the Director of Wellness and Health Promotions at the Knox County Health Department, and she's part of the Knox County Emergency Management Agency as a Public Information Officer. Is that right, Erin?
Yeah, that's a long title, but holy moly.
So important. It's like you're part of royalty or something.
I know, all within like the last 29, 30 days, right?
Right. Well, you know, and you've always served such important roles at the health department, and you and I have worked together for several years. I don't even know how long it goes back, but in my time in media sales with the newspaper and the radio stations, and so you've worn a lot of hats, and obviously you provide really great information to the community, and I'm so glad that you're in the positions you are, and to help us understand, navigate some of the questions that are, obviously people have right now. So do you want to kind of explain your role at the health department, and then kind of how that integrates with the unified command, how that works all together?
Yeah. As you said, I am the Director of Wellness and Health Promotion here at the Health Department, which encompasses a lot of different things, primarily doing community awareness. Community awareness from any age, from our young kids to our elderly, on many different topics throughout the community. We also encompass in that division our emergency preparedness grant that comes through, that comes down, that we work with. I've been at the health department for a very long time. So I've worn a lot of different hats here also. And one of them in the few recent years has been the Public Information Officer. And what that means as a whole through the emergency preparedness grant, when you're looking at your agencies, is if any type of media comes through the health department, they talk to the PIO first before they talk to anybody else in the building. And that's just so one unified, consistent message is brought out. And that also goes for the unified command. When the unified command opened for Knox County, the incident commanders of that unified command are Michelle Gabriel, the public health administrator here at the Knox County Health Department. And then you have Chief Randy Hoband with the fire department here in Knox County, or with Galesburg, I guess, fire department with Galesburg, but Knox County Emergency Management is what he oversees also. So we have a group of PIOs who work together from the health department, Carl Sandburg College, Knox College, OSF, Galesburg Cottage Hospital, City of Galesburg, Knox County. We have all of those where we all sit together, and we bring, most of us are the PIOs for our agencies, and we bring our information together so we have one unified message going out throughout the county to everybody.
Yeah, and I think a lot of people are becoming, if they're not familiar with unified command, they're hearing that, and some of the acronyms that are thrown around at some of the press conferences that you're present at, and a lot of the people you just mentioned who provide the information and updates to us. And like you've already touched upon, your role at the health department and with the PIO position, it really complements each other. And I think it's a really great fit to have you in that role. You're just very dedicated to our community, and throughout so many things that you've been part of with Relay for Life, you were always a part of Relay for Life as far as I can remember, in St. Jude, and as you mentioned, a longtime employee at the health department. So thank you for what you're doing and what you represent for our community, bringing that information and it being factual. And sometimes people don't want to wait, and they speculate, maybe have rumors, but it's really important for us to get the facts, and I appreciate what everyone is being able to do in that unified command situation. Can you explain what the PIO members communicate and how they provide that information to unified command? I know that you have a conversation daily with everyone that's in that organization. So that's probably part of it. But so the PIOs, how that works, and is that something that you meet separately for, or how does that structure flow?
The structure kind of works. Besides, we don't meet face-to-face daily. We do email a lot with each other. We work through, if we get daily questions from media, we share those in our Google Drive. That was the easiest way for all of us to kind of work together. We share those questions with each other, work on them together, because some of the questions might be public health related, while some more of them may be geared towards the hospital, one of the two hospitals, or we're looking at the school, District 205 or Sandburg or Knox, or even the county as a whole. So we answer those as a whole to get everybody's, I guess, the right information that needs to be said, because it's not always just a public health issue. If it's something that is more geared towards, just use it as an example, one of the questions we had a couple weeks ago was about respirators. That's not a question that I can answer as the public information officer from the health department, but then I can in turn put that question out and either ask, Carrie McCants or Elaine Innes at either of the hospitals, and then they can help further answer those. But we work together to have a consistent message, and we're all putting out the same message, because in our county, we don't want, conflicting information going out to our county residents who are reading our information or seeing our information. We want to stay united, unified in that front to get that consistent message out all the time.
And you mentioned several of the organizations that are under the unified command, such as the city, county. You mentioned the hospitals, Galesburg Cottage Hospital, OSF St. Mary Medical Hospital, Carl Sandburg College, Knox, and District 205, I believe, is part of that as well. And it's almost imperative that the message that's coming out is unified and the same, because otherwise, you're not able to tackle the spread of COVID-19 really, essentially, as effectively if you had this message going out in one place and a different message going out otherwise. So I think it's really great, everybody who's come together, the leaders of all of those organizations, and I've been really impressed, honestly, with how our community has come together, just in general, really. So I guess one of the questions I had myself was, as far as the health department goes, the guidelines that you put out, because I follow on your Facebook page and I see a lot of shares of your graphics that you have with all of those represented entities. Are you following guidelines set by the Illinois Department of Public Health and the CDC, or are you making decisions on your own, or how does that work?
We are following the guidance from the Illinois Department of Public Health and the Center for Disease Control. We are following both of those guidance. We get information sometimes daily, sometimes the information has been sent out and it's consistent and it hasn't changed, but we are constantly getting guidelines and guidance from them, and that is who we are strictly following.
Sure, and then that's obviously potential to change in a matter of moments, right? I mean, so you might be rolling out updates that might, I don't want to say contradict itself, but new updates you might have. So some things might change. And I think
we've seen that a lot. I mean, earlier we sent out, I think it was mid-March or so, when we sent out guidance for businesses, guidance for healthcare facilities or long-term care facilities. Some of those guidances have stayed consistent on the CDC page or IDPH page to where they haven't changed, but some of those have been modified or updated. So we then in turn, we switch those out. We put the new information up, because with it being a novel virus, it's new. So we're still learning, as we go daily, as we get new information.
Sure. In the health department, I assume you guys field a lot of calls about coronavirus, COVID-19 from the community and business members as well. And, whether they're rumored or confirmed details, people are probably wanting information. Everybody wants to know every detail they can about something. Because once we had a confirmed case, I think that really made people kind of, okay, it's here now. But we're not seeing an influx at this point, really. And it seems that when I hear Michelle speak last night, I was listening to her on WJIL, the rebroadcast of that. I was listening, and and Randy Hoven. And it's really nice to hear the conversation because everybody, there's such a good handle on it, it seems like.
Yeah,
And
they work well together.
yeah, they really do. They really do. So who or where is the appropriate place if somebody wanted to know updated information? I think from what I've seen, you can look on a multitude of websites, but what's the best resource for Knox County and the surrounding area to get that information if somebody's wanting to kind of monitor what's going on in the area?
If you're looking for stats, the best place that we can tell you to go is on the City of Galesburg's webpage. They have what's called the Knox County Unified Command Dashboard, and those numbers are updated daily to where they are put on there, and that's where you can find our total tests that have been, sent out so far, our negative, how many we've had negative, how many we have pending, and how many positives we had. And that is also on the WGIL site as well, but it is housed at the Galesburg, it's on the City of Galesburg's website. And as soon as you go to their page right at the top, there is a COVID, it's in a red box and it says COVID on it. So you can click on it. That would be the best thing for your stats. If you're looking for general information, we refer our call center, as you said, people calling in. We do have a call center here that is staffed full-time right now that we are referring people either to CDC or Illinois Department of Public Health because that is where the main guidance is set forth. You can also check our social media pages too because we're putting a lot of information out on those too.
Yeah, I follow along on your social media. I think it's great, the information you're putting out there, and it's just easy to understand and digestible too. I think that helps the public just know how to move forward with things. And I encourage anyone who hasn't checked it out, check the Health Department Facebook page from time to time because they do put out really good information it's simple to understand, at least from the standpoint of just an individual, I think. Because there's so much that's confusing about all of this, and it's a really great place to check about the most updated guidelines, I think. And you guys have it.
Sorry.
You're fine.
Everything that is put out, even though it's on our social media page for the health department, that is information that is worked on by the PIO group. We work on all of the screens that talk about when we recommend that you wear a mask, how to wear a mask, like the do's and don'ts during the holiday, all of those things and everything that's put out is worked on by that group as a whole.
So when there is a positive case that comes up in the county, which there has been, how is that communicated? Because I think people start hearing things and sometimes it's nothing, and then sometimes obviously it is something, but how is that internal communication process? And then once it's made public, that process, how does that work?
The process for the health department comes through our lab system. When we would find out from about a positive would be through our lab system. And once it goes there, it is gone, it goes through the incident command and whether it's your incident command within the health department or the unified command through the county. Everybody has their own at their own individual places. And from that point, we get direction on, to get information and get a press release going to get out to the public so they can know that there has been, a case, a positive case when it was, case 1, 2, and 3 are the only 3 that we have currently. But yeah, it just comes down from the lab system. It goes to our incident commander and throughout the building. And then the PIOs are directed to help, get something going. And then whether it's just sent to the media or with the first, we did, the press conference that was there and brought that information to the public.
So, some of the suggestions that come out, they've kind of varied. And I think in the last month, this has been really going on for about a month right now. I think people are unsure of proper safety measures. At one time it was, well, we don't need to worry about masks, PPE for hospitals and staff members that are in essential workforce. And then now there's the suggestion, well, cloth mask may be a good idea. How does the health department how do they make those suggestions for us to wear masks or when we're out in public or if we're in essential workforce, if that's what we do, if we're in a position where we need to go to work? Do you suggest we do actually? I'm not sure what the stance is on that.
Currently, right now, the citizens are asked to follow the latest guidance, and that's from the CDC. The Center for Disease Control does recommend wearing cloth face masks. Recoverings, if you're in public settings where social distancing can't be maintained or may be harder to do. That may be, maybe you're going to pick up your food, maybe you're going to the grocery store, to the pharmacy, going to some of those essential locations to get essential stuff. So they're recommending that you wear your mask, but you still have to follow your social distancing. Just because you have a mask on doesn't mean you don't need to practice your 6 foot of social distancing from individuals who are around you. So wearing the face covering and doing the social distancing can help slow that spread, and it can help people who might possibly have the virus and don't know they have it from passing it to others.
So as far as who does the face mask protect, the person wearing it or someone you might come in contact with, or is it both? Because I guess I don't understand, and I know that a lot of people are making them right now, which is amazing. My mom made several for us, and they're really cute, to be honest with you. I know so many people are really wanting to step up and donate, and I think it would probably be a good idea if we know, is it protecting us as the individual or everyone else, or how does that work?
All right, so the face covering, as we said, it's an incredibly valuable tool to slow that spread. And I'm going to read this because I had to write it out so I didn't tongue twist my words as I said it. But the covering is intended to protect those around the wearer. The face coverings simply prevent the moisture droplets and everyday breath from floating in the air around us. But again, that doesn't mean that you don't have to social distance from those that are around you. The two practices are meant to work together to provide the best amount of protection. That helps?
Makes sense. Yeah, that makes sense.
And
maybe we'll copy that and put it in the comments below. So
I can totally do that.
Yeah,
but the masks, so many people are. I mean, the amount of people, as we talked about, not just the Unified Command, but the amount of people in the community who are doing great things. And the mask making is incredible with the number of people who are making them for the hospitals, for the firemen, for the police, for the health department that we got. I mean, I had a lady that I grew up around. She made me the cutest John Deere tractor one. Like, it's the cutest thing, to wear if I want to go to the store. But we're protecting not only we're protecting, it's helping protect everybody, but we have to make sure that we're also social distancing when we go out and wearing them. It doesn't mean you can go still stand right up next to each other, or get a group of people together just because you have the masks on. You still have to practice that social distancing.
And we actually had a survey go out that we had a couple weeks ago to our membership, and some of the questions that we've recently had from businesses actually, and this was kind of an area I wanted to talk about. It's directly related to determining the best business practices in the workplace. And I think that we talk about washing our hands and social distancing, but we can't really probably say that enough, at least from the public health standpoint.
Right.
But for a business who's still open, so they're an essential business, they have employees working, what's their best practice to lessen the spread of COVID-19?
Some of the biggest things they can do is that if their employees are sick or if they have symptoms, let them stay at home. That's the biggest thing. Let them stay at home, and some of those symptoms can include fever, cough, shortness of breath. And then we would want them to continue to follow the CDC guidelines that are put out. And when this does go up on live, I am going to share, there's an amazing flyer that states all of that information on that flyer, and I would like to share it in the comment.
Absolutely.
When we're done, because it's a great flyer just to go by. But as much as possible, if somebody, their best practices, encourage those people, if they do feel sick, to go home, try to stay away from other family members. Like you said, the biggest thing is wash your hands. It's sing that happy birthday song, sing your ABCs, but wash your hands for 20 or so seconds with warm water if you can. Continuing to cover mouth and sneezes or coughs and sneezes with tissues, and making sure you throw that tissue away in the trash can. And then guess what you need to do once you're done coughing or sneezing? Wash your hands again when you're done. A big thing would be if you're still in the office, making sure you're cleaning surfaces. We have a cleaning schedule here within the health department and the community health center now, where everybody has a day where we are mandated. Not only does our regular janitor do our cleaning, but 3 times a day we get up and we each have a certain hallway within the building that we have to clean 3 times a day. So it's cleaning your light switches, it's cleaning door handles, it's cleaning workstations. If you are in your own office and somebody comes in there, making sure you're cleaning where you touch on your copiers all the time, not your screens, but the things that people touch, from your time clocks, your telephones, your cell phones, your handrails. If you have an employee break room, what about the handles to the refrigerator or the coffee maker? Or, you don't think about those things. You think about them at home, well, I wash them there, but you need to keep all of those. And that just helps lower the chance of spreading something where people are constantly touching throughout the day. And when you are in the building, you need to practice your social distancing as much as possible, which can be difficult in some buildings. But if you are still being deemed essential, try to practice that social distancing as much as possible.
I think with this being a pandemic, and the last one that I think has been known in history was over 100 years ago, businesses don't have that crisis plan really. And a lot of people we've talked to, I would say that a huge majority of businesses didn't really have a solid crisis plan arranged and really understood, what to do in a case like this, maybe tornado, but I'm not sure if, I think that a lot of people are going to probably be rolling some disaster planning mode into play once we're able to get back into the office. But the best advice for an employer, you've gone over a lot of the techniques that you just mentioned, but does an employer need to check temperatures at the door? Is that necessary, or are there any other steps or measures that an employer can take just to stay on top of monitoring the situation?
I think if you're going to have, essential workers coming in and out, you can streamline many different ways. That is one of the ways we streamline in our building. We have one entrance now only open to the health department. Our back doors that staff used to go in and out of are locked. Our health center door is locked, and it's just our main entrance. And every staff member here, when we get in the morning, is screened. We're screened when we first come in by getting our temperature, asked a series of questions, and then we can exit out the back door if we have to leave during the day for something, but you always have to come back in during the front door. So I think screening at whatever level somebody chooses to, is their choice. There's a lot of really good guidance on the Illinois Department of Public Health's website that the health department would be more than happy to share or help guide somebody through how to get to it and how to do that and start it in their own business. We'd be happy to work with people if they wanted, to streamline into their agency.
If someone were interested in talking to the health department, should they just call the main line, or is there someone directly they should speak with?
They can call the main line at 344-2224, and what will happen is they will probably be sent to our call center, which is where our calls are all going to, and what those individuals are doing there, then filtering them, whether it needs to be to go to our safety person who deals with all of the PPE, the personal protective equipment that is being used for if people need to order that through healthcare settings or whatever. We also have somebody who does medical. Media is filtered to me, so they know exactly where each of those would go to, but they could call us and we could definitely get them to the right person.
And as far as if an employer has a concern of an employee, maybe they're coming to work and they're just, people are hesitant, and so that manager's wondering, hey, is this person sick, or should I say something? They might have a concern. How should they handle that? I know that's probably individual to each business, but as far as a concern and just bringing that to the attention of the employee who's maybe at work.
The CDC recommends that if somebody does, show up, or enter the workplace and they think they have the symptoms, or they think that they have COVID-19, they can ask the person, to go home, if you're sick. And most people most people have mild illness is what the CDC is saying, and most individuals are able to recover at home. But if you think you've been exposed, you are having having symptoms, you should call your healthcare provider, and a business, should feel free to look at those guidelines, see what they are, and just be open and honest with your employee about, this is the guidance that we're following right now, and just work with your employer on that.
And the best advice for an individual who is maybe feeling ill and might have a symptom or so, probably the first thing to do is to call your healthcare provider, right? And then unless it's severe, obviously, right, go to the emergency room probably at that point. If it's severe, you're having trouble breathing. Is that pretty much the suggestion?
They always want you to call first, whether it's with your healthcare provider or if it's with the emergency room. They want you to call first before you go, because they will they can ask you a series of questions, and then they can determine, where you should go. But you should definitely always call before you go, because they do have guidelines on as to how they're working, with the emergency rooms. And, and you see a lot on the news right now of people not being scared when they go in, even if it's a little kid, going in with symptoms, because people are wearing more PPE. So, and that is just to protect not only them, but you. So just be aware that is happening. But we don't want anybody overloading the hospital systems. We would like them to call first before they go. That's the biggest
thing. Always call first. Always call your doctor first.
Yep. Yeah.
And from the conversation we've had, it sounds like there are a lot of resources available on the health department website, and that would probably direct people to the Illinois Department of Public Health and the CDC. So people can turn to those trusted sites for the latest guidelines and updates.
Yes.
And I want to again mention about your Facebook page. I think that's really a great local tool for people to check out. You have the up-to-date information, and it might change from one day to the next, and as things come up, but just to follow back on that, for those things that don't really require a phone call to the health department, you could probably find out on their Facebook page or website. And I think that you guys are doing a really great job. I can't thank you enough. And Erin, it's always a really great pleasure to talk to you. I think that we're all trying to do what's best for the community and the world. And you guys are such an important piece of the puzzle. So I really appreciate everything that you do and your team at the health department and with the emergency management system as well. So
thank you.
Yeah, I appreciate that. So, and thank you for coming on today. I know you're very busy.
Oh, this is a breath of fresh air, something new and different to try.
Yeah, you squeeze a little time in for me, and I appreciate that. So your cooperation is very much appreciated.
Thank you.
Yep. So if you do have any more questions, you can call the health department directly. With the phone number in the comments below, and the website as well, and just the resources that we mentioned. We'll include that in the comments in the comment section. And I think Erin will also maybe upload some graphics or images that might be helpful for businesses and individuals as well. So
yes, I'll attach the business guidelines at the link in there, but I'm also going to attach some masking and the what I should do or who I should call information on there too for everybody.
Wonderful. Well, thank you so much again, Erin. I hope you have a good rest of your week here, and we will talk to you soon.
All right, thank you.
Yeah, you're welcome.